Prostate cancer is the most common non-skin cancer among men in the United States and the UK. The numbers are sobering: 1 in 8 men will be diagnosed during their lifetime. And this is key, not all prostate cancers are created equal. President Biden's diagnosis, from what has been shared publicly, appears to be in the early stage. Likely detected through routine screening, it underscores a simple truth: early detection saves lives. So what's the first takeaway? Screening matters. Doctors typically recommend starting screening around age 50, but if you're African American or have a family history, that conversation should begin closer to age 40 to 45. Let's break it down. The prostate is a walnut-sized gland just below the bladder, vital for semen production. As men age, the risk of prostate issues rises, including cancer. Prostate cancer can range from very slow-growing tumors that may never cause harm to aggressive forms that can spread rapidly to bones and lymph nodes. Doctors use a few tools to understand what kind of cancer a patient is dealing with. PSA blood test measures prostate-specific antigen. Digital rectal exam, yes, it's awkward but potentially life-saving. MRI and biopsies, for a closer look at the prostate tissue. And once diagnosed, it's often scored using something called the Gleason grade, helping doctors determine how aggressive it is and what to do next. Now comes the part that many patients fear but should also feel hopeful about: treatment. In President Biden's case, as with many early-stage diagnoses, options likely included active surveillance, careful monitoring with no immediate treatment; surgery, typically a radical prostatectomy which removes the prostate gland; radiation therapy, often external beam or sometimes radioactive seed implants. For higher-risk patients, hormone therapy and chemotherapy may come into play. But here's the good news: prostate cancer has a very high survival rate when caught early. Over 98% of men survive at least 10 years post-diagnosis if treated appropriately. But it's not just a medical story, it's an emotional one too. A prostate cancer diagnosis can shake a man's identity. The side effects, like erectile dysfunction, incontinence, or just the word cancer, can lead to depression, anxiety, and social withdrawal. That's why support systems, partners, friends, even support groups, are crucial. President Biden's openness may help destigmatize a diagnosis that too many men suffer with in silence. If a sitting president can face it, talk about it, and navigate it, so can you. Medical science is moving fast. From precision medicine to immunotherapy and even liquid biopsies that detect cancer via blood samples, the future of prostate cancer care is promising. More importantly, public figures like President Biden help bring this conversation into the spotlight. Their visibility prompts policy changes, funding for research, and public awareness. And let's not forget the disparities: black men are more than twice as likely to die from prostate cancer than white men. That makes equity in screening and care an urgent priority. So what does a prostate cancer diagnosis like Joe Biden's mean for you? It means that no one, no matter how powerful, is immune to the realities of aging and health. But it also means that with screening, early detection, and advances in treatment, we're rewriting the story of prostate cancer. If you're a man over 50 or younger with risk factors, talk to your doctor. Start the conversation. It might just save your life.